Good day, we are the Group 2 from BSN 1 RM and we will be discussing the communicable diseases of the digestive system.
Now let's move on to the introduction to communicable disease. Communicable diseases, also known as infectious diseases, are illnesses caused by pathogens such as bacteria, viruses, fungi, or parasites. These diseases can be transmitted from one individual to another either directly or indirectly. So, direct transmission occurs through physical contact, respiratory droplets, or bodily fluids, while indirect transmission involves contaminated food, water, surfaces, or vectors like mosquitoes. So there are 6 key characteristics of communicable diseases include first, pathogens. These are the causative agents of communicable diseases that can be diverse, including bacteria, viruses, fungi, and parasites. Second is the transmission modes, such as direct contact, indirect contact, airborne transmission, and vector-borne transmission. So direct contact involves person-to-person contact, while indirect contact involves contact with contaminated surfaces, food, water, or vectors. And the airborne transmission involves the spread of pathogens through respiratory droplets, expelled by coughing, sneezing, or talking, while the vector-borne transmission involves the spread of pathogens through vectors, such as mosquitoes, ticks, or fleas. And the third is the incubation period. These are the time between exposure to the pathogen and the onset of symptoms. This period varies depending on the disease and the pathogen involved. The fourth one is the symptoms. Symptoms of communicable diseases can range from mild to severe and can affect various parts of the body. Common symptoms include fever, fatigue, cough, diarrhea, and muscle aches. The fifth one are the prevention and control. Strategies to prevent and control the spread of communicable diseases include vaccination, hand hygiene, safe food and water practices, use of personal protective equipment or PPE, and vector control measures. Also, public health measures such as quarantine, isolation, and health education also play an important role. And the last one is the global impact. Communicable diseases have significant impacts on public health, causing illness, disability, and death worldwide. They also pose economic challenges due to healthcare costs and loss of productivity.
So now, let's discuss some of the communicable diseases of the digestive system. So first, it's cholera. So cholera is an acute intestinal infection resulted from consuming food and water contaminated with the Vibrio cholerae bacteria. So this affects the intestines, which results in severe diarrhea, dehydration, and in worst cases, even death. So cholera is spread through contaminated water or food. When an infected person's feces enter a water system, it spreads the Vibrio cholerae bacteria in the water. This in turn puts people who uses the water for drinking, cooking, and washing at high risk. Upon exposure, the bacteria releases toxins that causes the body to produce excessive amounts of water, resulting in the onset of symptoms. So what are the signs and symptoms of cholera? So the signs and symptoms of cholera infection usually occur between 2 hours and 5 days after exposure. So this commonly includes diarrhea, dehydration and intense thirst, nausea, and vomiting. For diarrhea, the infected person's stool appears similar to water that has been used to rinse rice, appearing milky and watery. So other symptoms of cholera infection include low amounts of urine, muscle cramps, irritability, nausea and vomiting, weakness, low blood pressure, rapid weight loss, and loss of skin elasticity. So what are the ways we could prevent cholera infection? So first, drink only safe water or water that has been treated, boiled, or bottled. Second, use proper sanitation facilities. Third, eat only thoroughly cooked food. Fourth, always perform hand hygiene or hand washing. And fifth, thoroughly wash fruits and then peel them.
Now, for the second communicable diseases in the digestive system is the salmonellosis. So, salmonellosis is an infection from a bacteria called salmonella. Salmonella live in the intestinal tracts of animals, including birds. Salmonella are usually transmitted to humans by eating foods contaminated with animal feces. And for the signs and symptoms, symptoms of salmonellosis usually begin within 12 to 96 hours after exposure, but can begin up to 2 weeks after exposure. This includes diarrhea, abdominal pain and cramps, fever, nausea, vomiting, chills, headache, or blood in the stool. Now for the causes of salmonellosis, the first one is infected food and water. Commonly infected foods include raw meat, poultry, and seafood. Feces may get onto raw meat and poultry during the butchering process. Seafood may be contaminated if harvested from contaminated water. Next is raw or undercooked eggs. While an egg's shell may seem to be a perfect barrier to contamination, some infected chickens produce eggs that contain salmonella before the shell is even formed. Next is unpasteurized dairy products. Unpasteurized milk and milk products, sometimes called raw milk, may be contaminated with salmonella. And the pasteurization process kills harmful bacteria, including salmonella. Second is improperly handled food. Many foods become contaminated when prepared by people who don't wash their hands thoroughly after using the toilet or changing a diaper or after handling contaminated food. Third one is infected surfaces. Infection can also occur if people touch something that is contaminated and then put their fingers on their mouths. And the last one is infected pets and other animals. Animals and pets, especially birds and reptiles, may carry salmonella bacteria on their feathers, fur, or skin, or either in their feces. Some pet foods may be contaminated with salmonella and can infect animals. Now for the prevention of salmonellosis. You can avoid getting salmonella and spreading bacteria to others in several ways, including wash your hands. Washing your hands thoroughly can help prevent the transfer of salmonella bacteria to your mouth or to any food you're preparing. Wash your hands with soap water for 20 seconds after you use the toilet, change the diaper, and handle contaminated foods. And next is keep things separate to prevent cross-contamination. Store raw meat, poultry, and seafood away from the other foods in your refrigerator. If possible, have 2 cutting boards in your kitchen, one for raw meat and the other for fruits and vegetables. Never place cooked food on an unwashed plate that previously held raw meat. And then wash food preparation surfaces thoroughly with soap and water. Also, avoid eating raw eggs because homemade cookie dough, ice cream mayonnaise, hollandaise sauce, and eggnog all contain raw eggs. If you must consume raw eggs, make sure they have been pasteurized. And then cook and store food properly. Then lastly, be sure to cook food thoroughly and refrigerate or freeze food promptly.
The next communicable disease in our digestive system is shigellosis. Shigellosis is an infectious disease caused by bacteria of the genus Shigella. It primarily affects the gastrointestinal tract, leading to the inflammation and damage to the lining of the intestines. Shigella is highly contagious and requires only a small number of bacteria to cause infection. A wide variety of foods can be contaminated with Shigella, which include the salads, potato, shrimp, chicken, fruit, and lettuce. Contamination of these or other foods is through the fecal-oral route. This means the food has come in contact with water that has been contaminated or has been handled under unsanitary conditions. Shigellosis can spread quickly once a person is infected due to the nature of the fecal-oral transmission route. The incubation period for shigellosis typically ranges from 1 to 3 days after exposure to the Shigella bacteria. During this time, the bacteria are multiplying in the host intestines, but symptoms have not yet appeared. After the incubation period, the infected person will experience signs and symptoms including the diarrhea, often watery and sometimes containing blood and mucus. Second is abdominal pain and cramps, severe and painful cramping, particularly in the lower abdomen. Then third is fever, and fourth is nausea and vomiting. An infected person can spread Shigella bacteria from the onset of symptoms until about a week after symptoms resolve. However, in some cases, individuals may continue to shed bacteria in their stools for several weeks after recovery, even if they have no longer any sign or symptoms. The list of possible causes of shigellosis are: first is contaminated food and water. Next is poor hygiene practices. Third is direct person-to-person contact. And last is placing your contaminated hand to your mouth, or the fecal-oral transmission. Preventing shigellosis involves several key strategies aimed at reducing the risk of the infection and transmission. Here are some important prevention measures. First is personal hygiene, which includes hand washing and avoid sharing personal items. Second is safe food practices, which includes cook food thoroughly and wash the food, especially meats and vegetables. Third is safe water source, which includes drink safe water or clean water, and also avoid ice made from potentially contaminated water. And last and most importantly is health education and being aware about shigellosis and how to avoid this type of disease or infection.
Hepatitis A is a liver infection caused by the hepatitis A virus, HAV. It is a highly contagious virus that can spread through contaminated food or water or close contact with an infected person. Unlike other hepatitis viruses, hepatitis A doesn't become chronic. While it can take a few weeks for hepatitis A symptoms to show up after infection, some people might not experience any at all. These symptoms are usually mild and clear up within a few weeks. In some cases, however, hepatitis A can cause a serious illness that lasts for several months. Here are some of the most common symptoms of hepatitis A: fatigue, loss of appetite, nausea and vomiting, abdominal pain or discomfort, dark urine, clay-colored stools, jaundice, yellowing of the skin and eyes. Hepatitis A is caused by the hepatitis A virus, HAV. A virus invades your liver cells, making them inflamed. This disrupts your liver's function and leads to other symptoms of the illness. The virus is spread through the fecal-oral route, which means that infected stool gets into the mouth of another person. This can happen in a number of ways, including eating or drinking contaminated food or water, close contact with someone who is infected with the virus, such as through sex or caring for someone who is ill, traveling to a country where hepatitis A is common. The best way to prevent hepatitis A is to get vaccinated. The hepatitis A vaccine can prevent infection with the virus. The vaccine is typically given in 2 shots. The first shot is followed by a booster shot 6 months later. The hepatitis A vaccine can be given in a combination that includes the hepatitis B vaccine. This vaccine combination is given in 3 shots over 6 months. Other preventive measures include washing your hands thoroughly with soap and water after using the toilet and before changing diapers, avoiding close contact with people who are sick with hepatitis A, getting fruits and vegetables from reputable sources and washing them thoroughly before eating them. drinking bottled or treated water when traveling to areas with poor sanitation.
Now let us move on to the viral gastroenteritis. Viral gastroenteritis, also commonly referred to as the stomach flu, is an inflammation of the intestine caused by a virus. It irritates and inflames the lining of your stomach and intestines, leading to uncomfortable symptoms like diarrhea, vomiting, and stomach cramps. Now we will move on to the causes of viral gastroenteritis, which is the rotavirus, norovirus, and adenovirus. First, the rotavirus, which is a virus most often infects infants aged 3 to 15 months. The illness lasts for 3 to 7 days and is most common in fall and winter. So, rotavirus is most common cause of severe gastroenteritis in the infants and young children. It is transmitted through fecal-oral contact, and the symptoms are watery diarrhea, vomiting, fever, and abdominal cramps. This can lead to dehydration, especially in young children. Next is the norovirus. This virus is most common cause of adult infections. It's often responsible for outbreaks on cruise ships, and symptoms last for 1 to 3 days and can occur any time of the year. It is the leading cause of epidemic gastroenteritis, including foodborne outbreaks. It affects people of all ages but more common in adults and older children. It is transmitted through fecal-oral contact, contaminated food or water, and contact with infected people. Symptoms are watery diarrhea, vomiting, nausea, and abdominal cramps. It usually resolves within a few days and there is no specific treatment. It focuses on preventing dehydration. Lastly is the adenovirus. This virus occurs year-round and affects children aged 2 and younger. Symptoms last from 5 to 12 days. It can cause gastroenteritis but also respiratory infections, conjunctivitis, and other illnesses. It is more common in children but can affect adults as well. It is transmitted through respiratory droplets, fecal-oral contact, and contaminated water. Symptoms are watery diarrhea, vomiting, fever, and abdominal cramps. It usually resolves within a few days and there is no specific treatment. It focuses on preventing dehydration. So in the image, you can see that the viral gastroenteritis is caused by the inflammation of the stomach and inflammation of the small intestine. And it is caused by 3 viruses, which is adenovirus, norovirus, and rotavirus. So these are the common signs and symptoms that you will experience once you have the viral gastroenteritis. First is the appetite loss, headache, nausea or vomiting, abdominal pain, fatigue and tiredness, and lastly, fever and chills. Now let us move on to the prevention of viral gastroenteritis. So there is no specific treatment for this virus. We should just focus on symptom relief and maintaining hydration. We should drink plenty of fluids such as water, oral rehydration solutions, or clear broths. We should also avoid caffeinated and sugary drinks. So first, if someone in the house has gastroenteritis, wash all the surfaces that might be contaminated with a bleach-based cleaner. Thorough cleaning and disinfection are crucial to prevent the spread of gastroenteritis and to protect others in the household. Second, get vaccinated against rotavirus for children. Children under 5 years old are most susceptible to viral gastroenteritis, especially rotavirus. This is why rotavirus vaccine is recommended for young children. The vaccine is given by mouth as drops, and the virus vaccine is safe and effective. Third, wash hands before eating and handling food and after going to the toilet. It is important that we wash hands since this prevents the spread of microorganisms. Fourth, ensure all food are cooked thoroughly. Since undercooked food can harbor harmful bacteria like Salmonella and E. coli, to prevent food poisoning and risk of foodborne illnesses, we should thoroughly cook our foods. Lastly, be careful when handling patients' vomit. Since vomit can contain infectious agents like virus, bacteria, and parasites, this can be transmitted through contact with contaminated surfaces or body fluids. So we should be really careful when we encounter vomit.
So that concludes our presentation of the communicable diseases affecting the digestive system. So to summarize, our group presented several communicable diseases affecting the digestive system, and these are cholera, salmonellosis, shigellosis, hepatitis A, and viral gastroenteritis. These diseases emphasizes the importance of hygiene, vaccination, and safe food and water practices in preventing the spread of infections.